Kelly, thank you so much. I'd like to invite Kelly and Chuck back on screen and have a really a robust conversation about all the wonderful materials that Kelly had shared. Kelly, what struck me most about your earlier comment regarding the impact of cultural competency was really starting with know thyself and then a listening and then really having that positive reinforcement in that mindful communication. So often when we've worked with our mental health and addictions providers, there's just this overwhelming amount of to-dos, right? And so to take a moment to just simply breathe and concentrate on that relationship with our colleagues is such an important reminder.
Yeah, absolutely. That self-awareness and that self-regulation piece in the moment is so critical, right? We can get so caught up in what's happening around us at any given time that sometimes we don't necessarily give ourselves permission to take a step back, to take a deep breath, and to allow our intelligence, right, and those gut feelings to actually come to the surface and lean into those ways that we know that we can respond versus react and move in the direction of creating positive outcomes for everybody.
Absolutely. Oftentimes, when we are having conversations regarding building capacity and bringing on additional workforce, and just looking at the size and scoping of the work to be done and the number of patients to serve within our neighborhoods, there's such a kind of overwhelming amount of, we've got to get this done. And on the other hand, there's this also, well, my employer should fill in the blank. So I really love how this conversation has been about what we ourselves can do first to impact our environment. And then where do we go from there? So I'd love for Chuck to kind of have a weigh in on having worked with so many organizations across industries. When you're kind of broached with, oh, we need workforce, resources, and this other opposing view of, yes, but our employers should, how have you kind of found that middle ground to start that conversation when sometimes we just don't want to hear it starts with you?
Sonia, it's really tough in that regard, just simply because, especially folks in the mental health profession, they are so consumed and focused on making sure that everybody else is being taken care of that they forget to take care of themselves. Mm-hmm. And it's funny, I'm just going to flat out say it. It's okay to take care of yourself first. And if we don't, you're not going to be around. I will tell you, and again, I'm going back to a faith-based situation. A very dear mentor friend of mine, a guy I met in college, was a Catholic priest. And he tells the story of, he was meeting with his doctor, and his doctor said, you need quadruple heart bypass surgery today. And his immediate reply was, I'll be right back. I got to go take care of another family. This is exactly the problems that we start to run into, especially as we start to talk about this mental health space. And it's really interesting, especially, there's just been a brand new piece of legislation piece of research that just came out with regards to the fact that maybe it's not serotonin levels. Maybe it's the environment that we live in. Maybe it's the people that we are associating ourselves with. It's those toxic environments. It's those toxic relationships that really have a huge impact on everything we do. So when you look at it, and again, this is what I'm going to highly recommend at the workplace level, and I have probably consulted with 2, 3, 4, 5, 600 different organizations, been able to assess them. I will tell you, it's the manager. It's the manager almost every single time. Okay. And that's what we've got to remind ourselves. How do we make sure that those managers are truly making sure that the widgets are getting made or the services are being applied, but also how are they taking care of their employees? And that should be one of the critical factors of success in making sure that that person's job is truly a well job.
Such specific and well articulated points, Chuck, of take care of yourself first. That is everyone's main action from this webinar, to really sit down and consider what is the need of you on a day-to-day to continue to be this high-performing, supportive individual for our mental health ecosystem. And then, yes, looking towards our organizations to say, do our managers that are looking at employees and really responsible for high-functioning teams, are they equipped and do they have the training to really be people first and employee first? That's fantastic.
And it takes competency. And when we talk about that word, it's not that you're not good at what you're doing. It's just that sometimes you got to be reminded. As a former HR director, I also jokingly referred to myself as the chief reminding officer a lot of times. So think about it from that perspective. Remind yourself what's good for you is what's good for them. And if you're great, chances are that can be virally equally available to those folks that are around you. Be their energy if they need it, and then use their energy to bring you up as well.
I love that. Those are such great motivational factors that really can be lent to as not only to-dos, but also specifically reminders of how do we show up, how are we present, and how can we continue to really engage our teams and continue to motivate ourselves individually to be that support. Kelly, you had such very clear, concise, detailed actions to say, this is what you can do every day pertaining to not only the 6 dimensions, but then also had a fabulous wrap up of its impact in multicultural environments, and specifically, and I think you listed like 20 plus from identities all the way through to racial, ethnic. I think you discussed so much about environment and also geographies and so forth. With that complexity, taking these simple recommendations, tools and tips and tricks, and applying it to something as big and formidable as, how are you doing cultural competency for your organization seems simple, right? How have you seen that really been successful? And then where do you see the concerns when it comes to lack of that consistency?
So, yeah, gosh, there's so much to discuss there, right? The biggest thing, I think, first and foremost, is that awareness of self and others, right? So as we become more self-aware and we elevate that ongoing daily self-awareness, that shifts with us no matter which environment we're in. So I'm in my office right now, but as soon as I walk out of my office door, I'm in the home, and that's a different environment. If I go into the office, I'm in a different environment there. If I go into a boardroom, I'm in a different environment there, into my children's school, right? So all of those different environments. So that self-awareness, that confidence and connection to who I am as a human being, and that authenticity and transparency that builds my confidence, right? So that's really where we believe that starts, because if we create that growth in each one of those 6 dimensions of wellness, then that creates a more whole, well-rounded, holistic presence no matter where I go, right? So that's first and foremost. That then allows me to have awareness of others, and without judgment, without condemnation, with just respect, I can be around any of those individuals that are in that environment and not be thrown off if something goes awry, or I don't like the way they looked at me, or I don't like the way they spoke. Another very specific example, we have a daughter who's just starting a really big first grown-up job, right? And it's a government-funded nonprofit, and there was a big upheaval the last couple of weeks. It's in the mental health field. She works as a case manager. And they brought in a brand new CEO, and the brand new CEO came in just wielding, right? Tools and all kinds of things yesterday. And she just panicked and walked out and called and like, what do I do? How do I handle this, right? And it was that drawback immediately to what are you aware of with yourself? What are you aware of with others? And how are you going to regulate yourself in this moment? Walk back into that room and be the best that you can be. Listen to understand, ask questions to get clarity, and then implement what you know through your skill sets to be able to move things in a positive direction. You don't have to save anybody. You don't have to make a big deal out of something. You can pull people aside, managers and directors if you need to, right? So being able to be that person in that moment, that allows us to view every moment in every environment, every situation with that multicultural perspective, because we're grounded in who we are first. We have clarity about that, which gives us that clarity about others, and then stay true to that multicultural perspective. And if we don't understand, we get to ask questions to seek clarity.
I love how you've connected multicultural to the fluidity of the environments that you literally step into. At the same time that's so visual and so clear that culture changes with environment, there is a true amount of complexity about, am I aware of my own beliefs, perspectives, and communications and how they change in each of those environments? Our mental health and addictions providers, along with the folks on this call today, are continuously being bombarded by regulatory changes, legislative changes, and then not only forecasting regarding supply and demand on services. So I'm almost hearing like, take a moment, think through for yourself what your own position is, and then think about your position in every hat that you wear before you step out into that first environment, or before you are peppered with those first questions. To really ground yourself in, this may be how I think, feel, and believe, but this is the mindful communication that I must be prepared to participate in when I'm coming back into my multiple different types of roles and environments that I'm faced with every day.
Sunny, and you really think about it from a number of different perspectives, and that's that concept of authenticity and really understanding you can be your authentic self. You don't have to promote all of your authentic self every single time in every single situation. I've known you long enough, Sunny, to know that both of us are very outgoing, very high energy, very, we'll walk into a room and we'll try to take it over as best we possibly can. But we also are very mindful because we walk in and we assess before we really just fly in. And that's really the whole idea of what it's all about. But I love that concept of authenticity, that concept of curiosity, but that concept of intentionality, being intentional in what you're doing. But I also love my favorite quote of about a year ago, and that is, be authentic unless you're authentically boring or authentically mean. Otherwise, we do need to be very authentic in everything we do. And I think that's a big mental health focus that we need to help others truly understand. In today's society, I'll say it this way, 25 years ago, if you would have walked in with multicolored hair and, all kinds of crazy clothing, I'd have probably not looked at you very, very wisely. But now in today's world, it's like, oh, okay, you're being you. Good job. Can you do the job? You've gotten away from maybe a little bit of that visual, but at the same time being able to really master that idea of how can you help us and how can I help you, and really looking at it from that true authentic self.
And I love that comment because so the visual cues are what stem stigma and stereotype, right? And it's that mindful communication that really allows for the initial interaction of being able to listen and then being able to self-regulate responses. We talk a lot about self-disclosure, appropriate self-disclosure when we are mental health and addictions providers. And that self-regulation that Kelly has taught us today, that is the next level of appropriate self-disclosure to really consider and say, we do know ourselves. We have looked at all of the different roles and we have prepared what our answers are beforehand so that we can stop and truly listen and then consider the context of what our answers would be. Because to Chuck's point, yes, we love coming into a room and building up that energy and getting excited, but the assessment component of that is the most important. To say, our goals are always coming into a room to say, how can we collaborate and provide shared messaging for the benefit of that organization for that room? And for our mental health and addictions providers, when they're looking at how do I interact with a patient versus with a team or a colleague versus with a staff member, and what are the environments of those interactions, those are very prepared environments. And then when we have other environments that are outside of our traditional routines, then the question becomes, what is the message that you want to partake in this environment? What is the point of the communication that's being delivered? And is it focused on increasing our competencies, expanding our capabilities, scaling our services, and ultimately increasing the cultural competency of how we do the work within our organizations?
You know, a couple of things that I thought about while you were sharing, and that was just really eloquent and well stated, was when we go back to that listening piece and that questioning piece, if we come in fully prepared, and that's great, but we're all high functioning, high level, intelligent adults, do we stop those wheels from spinning in our head and we're preparing our answers and we're making assumptions based on what we've already prepared, instead of being fully present and self-regulated in that moment enough to turn all of that off, knowing that we are intelligent enough, if we listen and don't miss anything that was shared in that collective environment, in that collaborative environment, if we miss anything there, then what we say next may be completely irrelevant and not matter. That's a really critically important piece. And I think that that's where some of that cultural competency may be getting missed, because we have this playing in the background and we're making assumptions in the moment instead of maintaining that neutrality and just leaning into, I have the gift of this job. I have been asked to be here. I've been entrusted with these individuals, you know, whether it's my coworkers or the clients or the patients, and I'm going to lean into that gift and these skills that I've developed so that we can create the greatest possible outcomes.
Absolutely. Absolutely.
And the thing about that is, Sunny, and again, it goes back to who you are, how you've been trained, how you've been educated, how you've been brought up, how you've experienced life. And going back to that, especially that clinical health professional, they're going to treat you and diagnose you no matter what you try to do. How do we try to turn that off? And I do that all the time. I'm married to a clinical health professional. And so we talk about that all the time. How do we make sure that she's not constantly thinking about it from that clinician diagnose, treat philosophy and truly just listening to the whole picture? And that's a hard thing to sometimes turn off because that's what they have been bred to do, literally.
That's such a great point, because our communication pathways are trained to go through these processes and to, one, unlearn them, but then two, to appropriately utilize them in different environments. We don't want to treat, diagnose, and explain to our colleagues, to our team members. We want to listen first, right? And so I think that there's, just as you've given permission to everyone to say, please take care of yourself first, I think there's a secondary point as well from the context of what Kelly has provided in saying, it's not the first or the right answer, it's the best answer that we've collectively come together with. And so with that, we need to be able to have all of those mindful communication points to really say, you know, it's not just our problem. It's not just a community mental health center problem. It's not an employer problem. It's not just a this person problem. It's a collective our problem if we're not utilizing clear listening and translating that to mindful communication towards further environmental-based cultural competency as we have that send-receive of messaging in every interaction. That's hugely powerful. We've had lots of tools, tips, and tricks about cultural competency and improvements, change management, but you're really honing in on it's every time you are communicating. Wow, that's a wow factor for me of like, oh, every single time we communicate, we are either building up or depleting our cultural competency in our organizations.
We absolutely are.
Wow. On that note, any last insights for our audience? Thank you both so much. Kelly and Chuck?
I will start real quick. Just think about it from a perspective of what we've talked about in the 6 words of high-level wellness, 6 words that define high-level wellness. Function optimally within your current environment. And if you feel like you need to function better, improve your environment. And that's really what it's all about.
Fantastic. Kelly?
I think that's a great closing statement. I think, you know, we covered so much here, and there's so much more, obviously, that we could go on for hours and hours. But if we go back to the very beginning of what this presentation was all about, that social activation of wellness, we are each responsible for the development of and the contribution to our own, becoming our own best selves and creating that in those environments where we live, work, play, learn, and reflect. And continuing to evaluate on a daily basis, you know, how am I doing in each one of these 6 dimensions of wellness? And what can I do as I look into the mirror and I look out into the world? Where are some places that I can take action to have self-improvement, both personal and professional, to function more optimally within each of those environments that I'm going to be in from moment to moment? Because it's the moment-to-moment shift that creates that current environment reality. And we want to be able to function optimally in each of those as we move throughout our days and back and forth between our personal and professional lives.
Kelly, I feel like I should engage you as my life coach. Thank you so much. In all seriousness, though, the work that the National Wellness Institute is doing and the trainings offered by Kelly and her team are really foundational in supporting the continuous build out of organizational excellence towards staff and team members that have the social activation of wellness as the central foundation of organizational wellness. So I encourage you to reach out to both Kelly and Chuck as you look at additional areas of training, education, and overall organizational leadership and wellness consultation with their teams. Thank you all for your support today in listening to this webinar. Your certified education units through the authority of the Division of Mental Health and Addictions is right here below on the survey. that you can take, and you'll receive those CEUs within the next rolling 30 days as we are doing these as self-learning directed applications. Thanks all. Have a great rest of the day.